If you missed part 1, I covered the basics of alternative sweeteners and their effects on blood sugar and weight. But today, we're going to dive deeper into something that affects millions yet rarely gets discussed: how these sweeteners impact your kidneys, your longevity, and your long-term disease risk. There's a 2024 study from the UK Biobank. They followed over 400,000 people, and they found that drinking more than one artificially sweetened beverage per day increased the risk of developing chronic kidney disease by 26%. And what was even more concerning was that certain sweeteners might accelerate aging at the cellular level. Welcome back to the channel, everyone. I'm Dr. Hashmi, board-certified nephrologist and board-certified obesity medicine specialist. And in this video, I'm going to share what every kidney patient, every longevity enthusiast, and health-conscious individual needs to know about alternative sweeteners. Let's start with how alternative sweeteners affect your kidneys, both in healthy people and those with existing kidney disease. For healthy individuals, that UK Biobank study I mentioned that talks about a 26% higher risk with more than one serving per day of artificially sweetened beverages, let's look at it a different way. To put this study in perspective, this risk of increasing chronic kidney disease is similar to having untreated high blood pressure for several years. Now, when we start to think about this idea of chronic kidney disease and artificial sweeteners, there's a 2021 meta-analysis in the Journal of Nephrology. They found a dose-response relationship, and the magic number seems to be about 7 servings per week. Below that, the risk of developing chronic kidney disease isn't significantly elevated, but above that, each additional serving increases your risk. In other words, people drinking more than 2 artificial sweetened beverages daily had a 40% higher risk of kidney function decline. So the question is, why would sweeteners affect your kidneys? Well, there are several proposed mechanisms. First, some sweeteners can alter your gut microbiome in ways that then ends up producing more uremic toxins. Remember, these are compounds that damage your kidneys. Second is certain sweeteners can affect blood pressure regulation. And third is they might influence inflammation pathways that impact kidney function. So if you already have chronic kidney disease, the picture becomes more complex. Studies found high intake of artificially sweetened beverages were associated with a faster eGFR decline. That's your kidney filtration rate. However, evidence on proteinuria, or protein in the urine, is mixed. Some studies show no association, while others suggest that there might be an increase. Now, for my CKD patients out there who are listening, the question I have for all of you is, are you tracking your sweetener intake? Have you noticed any changes in your kidney function test? I would love to hear your comments below so that I can help you better in future episodes. Now, interestingly, not all sweeteners are equal for kidney health. A 2021 laboratory study found saccharin and sucralose might actually protect the glomerular microvasculature. Remember, these are the tiny blood vessels in your kidneys. But before you get too excited, this was in petri dishes, not people, and we can't extrapolate this supposed small benefit into clinical practice. And what about those sugar alcohols and natural sweeteners? The research here is limited. Erythritol is almost completely absorbed and excreted unchanged in urine. So theoretically, it shouldn't stress the kidneys. Stevia and monk fruit, they haven't shown any adverse kidney effects in available studies, but long-term data is still lacking. Now, for kidney stone formers, there's additional considerations. Remember, sugar-sweetened beverages definitely increase stone risk, about 23% with daily consumption. Artificial sweetened beverages also increase stone risk, but not as bad. It's only about 11%. But remember, it's not zero. The mechanism behind this higher risk of stones likely involves changes in urine composition and volume. So an important find, if you've had kidney stones, this data suggests limiting all sweetened beverages could reduce your risk. If this information is helpful to you, I would really appreciate it if you hit that like button, share this with anyone who might be dealing with kidney stone or has dealt with them in the past. Now, sugar alcohols don't appear to increase stone risk. They're largely excreted unchanged. And one of the things that's important about sugar alcohols is they don't significantly alter urinary calcium or oxalate levels. However, if you're prone to stones, be a little bit cautious because there can be high oxalate natural sweeteners. Some plant-based sweeteners can be higher in oxalates, and remember, oxalates can increase stone formation risk, but plant-based oxalate is absorbed substantially lower then animal. Let's get into some long-term health risks. Some of the most concerning findings are the links between alternative sweeteners and chronic disease. Now, I want to be clear. These are associations, not proven causations, but the patterns are still concerning enough that we need to discuss them. Starting with cancer, the Nutrisante cohort study was published in PLOS Medicine in 2022. They followed adults for a median time of 7.8 years. And what they found was that high consumers of artificial sweeteners had about a 13% higher risk of overall cancer compared to non-consumers. Breaking it down by specific sweeteners, aspartame had a 15% increased risk, particularly for breast cancer and obesity-related cancers. Acesulfame had a 13% increased risk. Now, the American Cancer Society maintains there is no clear evidence that sweeteners cause cancer at typical dietary intakes. The discrepancy likely comes from dose and duration. Most safety studies look at moderate consumption over shorter periods. These new cohort studies, they capture people who consume high amounts over decades. So the question that I have for everyone is, who out there is using artificial sweeteners or alternative sweeteners for more than 10 years? And if you are, share your thoughts below, and this may be a great chance to think about cutting back. Now, for cardiovascular disease, the evidence is a little bit more robust. There's a 2022 BMJ study from the same French cohort. What they found was high artificial sweetener intake had a 9% increased risk of cardiovascular disease overall, higher risk for cerebral vascular disease like stroke, and aspartame was linked to 17% increased risk for stroke. Acesulfame and sucralose were associated with a 40% increased coronary heart disease risk. But here's where it gets really interesting and concerning. Multiple studies now show increased all-cause mortality with high sweetener intake. There's a 2019 study in Circulation where they followed 450,000 Europeans, and they found consuming 2 or more artificially sweetened soft drinks per day was associated with a 26% higher risk of death. And compared to consuming less than 1 per month, each additional daily serving increased mortality risk by 8%. This is really a wake-up call. If you're drinking multiple diet sodas per day, research suggests it is very important to cut back. And if this motivates you to make a change, let me know in the comments below. The relationship, when you start to think about how much and how little, it is more of a J-shaped. In other words, there's a sweet spot where moderate consumption might be okay, but the risk increases substantially at higher intakes. And the threshold seems to be around 1 serving per day. Above that, the risk starts to climb very steep. Now, keep in mind, if you watch part 1 of the video, I talk about why I don't recommend sugar or alternative sweeteners and how natural foods, whole foods, fruits are the best way. If you have a sweet tooth, eat more strawberries. Now, type 2 diabetes risk is also another one that, because high blood pressure, diabetes, and obesity are the 3 kidney killers, it's important to talk about it. And so many people end up using sweeteners to prevent diabetes. Ironically, the Nutrisante study, once again, it found a 3% increased diabetes risk for each additional 100 milligrams of artificial sweeteners daily. Over a decade, higher consumers had about a 20% higher risk of type 2 diabetes compared to non-consumers. 2024 British Journal of Nutrition study added another piece to the puzzle. Using Mendelian randomization, technique that's used to help establish causation, they found evidence supporting causal links between artificial sweetener consumption and hypertension and type 2 diabetes. In other words, this suggests that the associations aren't just due to confounding factors, and there may actually be a causal relationship to know. All right, let's dive into the effects on aging and longevity. This is where the science gets fascinating and, in my mind, a little bit concerned. While we don't have direct studies showing sweeteners accelerate aging, we have concerning indirect evidence. First, inflammation. Remember, inflammation is a key driver of aging. There's a 2025 study from the Cancer Prevention Study, and what they found was that non-nutritive sweetener consumption was linked to higher levels of inflammatory markers, C-reactive protein, interleukin-6, and this was particularly in people with obesity. Remember, chronic inflammation is linked to accelerated aging and virtually every age-related disease. Now, for longevity enthusiasts, are you tracking your inflammatory markers and have you seen any changes with sweetener use? Let me know your data below. The gut microbiome is also really important to keep in mind as you're thinking about sweeteners. Your microbiome doesn't just affect digestion, it influences your immune system, brain function, and aging rate. That 2022 cell study I talked about in part 1, it showed that sweeteners like saccharin and sucralose dramatically alter the microbiome within just 2 weeks. These changes were associated with impaired glucose tolerance, which in itself is a marker of accelerated aging. Now, there are some researchers who have theorized that sweeteners might actually affect aging through hormesis. Remember, that's the biological principle where small stresses can be beneficial. Sugar consumption, despite its negative, triggers certain adaptive responses. By providing sweet taste without calories, though, we might be disrupting these ancient biological programs. Then there's also that question of cellular aging. While we don't have direct telomere studies on sweeteners, we know there's poor glucose metabolism, there's chronic inflammation, and both are potentially induced by sweeteners. The mortality data I mentioned earlier is perhaps the most relevant for longevity. If high sweetener consumption increases the death risk by about 26%, that's a significant impact on lifespan. For context, that's similar to the lifespan expectancy reduction from mild obesity. Put another way, if you think about this, choosing water over multiple diet sodas daily has the potential to add years to your life. And hopefully this is motivating you already to think about not just getting off sugar, but also getting off alternative sweeteners. Now, what about sweeteners that are marketed for longevity, like allulose and erythritol? They show favorable acute metabolic effects, but the problem is we just don't have long-term data. There's a 2023 study that showed acute administration of allulose or erythritol. It didn't adversely affect metabolic markers. But in my humble opinion, I don't think this tells us much about what their usage would have an impact over decades. Then let's get into the gut-kidney axis. And this is where we need to connect some dots that a lot of healthcare professionals miss, because the gut-kidney axis is so critical and vital to overall kidney health and overall longevity. Remember, your gut and kidneys are in constant communication, and alternative sweeteners sit right at this intersection. When sweeteners alter your gut microbiome, the effect ripples to your kidneys. So uremic toxins, certain gut bacteria produce compounds called uremic toxins. These are substances that healthy kidneys would normally filter out, but they accumulate in chronic kidney disease. The most studied uremic toxins are, of course, p-cresyl sulfate and indoxyl sulfate, and high levels accelerate kidney damage and increase cardiovascular risk. There's a 2023 review. It found that artificial sweeteners can increase production of these uremic toxins by promoting the growth of protein fermenting bacteria. Now, this might explain why sweetener consumption is linked to faster kidney function decline. The inflammation connection. So an unhealthy microbiome triggers intestinal permeability. In other words, you end up having a leaky gut, and this allows bacterial toxins to enter the bloodstream. Your kidneys then have to filter out these inflammatory compounds, and potentially you create damage over time. For kidney patients, this is particularly concerning because chronic kidney disease itself alters the gut microbiome. So there's this vicious cycle. And if you add artificial sweeteners, it can further disrupt the microbiome. So in other words, having artificial sweeteners could potentially accelerate the progression of chronic kidney disease. There's also emerging evidence about the gut-brain-kidney axis. In other words, sweeteners might influence appetite hormones produced in the gut, and these could affect eating behaviors that impact both kidney health and longevity. So hopefully what you're trying to see is there's this complex web of interactions that we're just barely starting to understand. And in the center is alternative sweeteners. Let's talk about some specific groups who might need to be extra careful with sweeteners. sweeteners. For children, the concerns are magnified. Their developing microbiomes and metabolic symptoms might actually be more vulnerable to disruption. There's a 2018 review that found associations between early sweetener exposure and increased obesity risk later in life. Some guidelines, Health Canada, they recommend limiting sweeteners in young children. The problem is sweeteners are everywhere. They're in medicines, they're in vitamins, they're even in toothpaste. So for parents, check your children's medications and vitamins. You might be surprised how many contain artificial sweeteners. For pregnant women, they also face unique risks because sweeteners cross the placenta and they appear in breast milk, meaning that fetal and infant exposure is there. And studies have found associations between maternal sweetener intake and 25% increased risk of preterm birth, childhood obesity. Then for the elderly, there's also a shift. Oftentimes, folks who are older, they might have compromised kidney function already. They might also have altered drug metabolism, and they're more susceptible to dehydration when you start to add things like sugar alcohols because of the GI upset and diarrhea. There are many sweeteners out there that are found in multiple medications and sugar-free foods, and especially our folks who are a little bit older might not realize how much you're getting in one single day. Now, when you look at people with diabetes, they face a paradox. Sweeteners are recommended to reduce sugar intake, but they might worsen glucose metabolism in the long term. So most doctors, health professionals, they say moderation and monitoring individual responses is key. On my hand, I say minimizing sweeteners, and if you can get rid of them, even better, along with sugar, is ideal. We're not talking about natural sugar found in fruits. We're talking about getting rid of added sugar and getting rid of sweeteners. And then for folks who have chronic kidney disease, I always recommend caution, and some might even say extreme caution with sweetener intake, especially high sweetener intake. While stevia and erythritol appeared safer based on small studies and in petri dishes, limiting all sweeteners is absolutely important because the risk of accelerating kidney decline, they outweigh whatever benefits you might get from switching over to sweeteners. Now, for folks who have already had a transplant, so post-transplant needs special consideration because they're on immunosuppressive drugs that already play a role in terms of higher risk of infections and so forth. The problem there is if you're adding sweeteners, which might increase inflammation or alter drug metabolism, that becomes concerning. So same thing, in my transplant patients, I tell them to minimize or avoid any type of alternative sweeteners. Now, reading labels for hidden sweeteners is its own medical degree in a way. Because, and I explain this to my patients, and they're always in shock because sweeteners, they hide everywhere. You might think you're avoiding them, but they're probably in products you use daily. So first, you need to learn the name. Sucralose, which will be labeled as either sucralose, Splenda, trichlorogalactosucrose, E955. Aspartame can be labeled as APM, E951. NutraSweet. Stevia can be steviol glycosides, Rebiana, E960. Sugar alcohols you'll usually know because they end in ol, OL, such as sorbitol, xylitol, maltitol. It's important to become a label detective. And you might as well start now. Your homework today is go check one product in your kitchen right now for hidden sweeteners. You might actually be surprised. Drop it in the comments below what you found. Remember, check your medications carefully. Many liquid medications, especially pediatric formulations, chewable vitamins, and acids, and even some prescription drugs can have alternative sweeteners in them. I had one of my patients who kept having GI problems from a very common vitamin that we give, and it turned out there was a significant amount of sorbitol in the product. As soon as we changed it, her symptoms improved. And one of the things that people always forget is they mislead labels. They see sugar-free. Remember, one, sugar-free doesn't mean sweetener-free. Number two is what it means is that it just has to have less than 0.5 grams of sugar per serving. All you got to do is make the serving really small, and you can put a label of sugar-free, and most people will have a tremendous amount. Kind of like when you look at the serving size of potato chips in a bag. I can tell you most people don't eat one serving. So when they look at the label for how much sodium there is, they're not looking at it correctly because they end up eating far more than that. So you want to remember that a lot of sugar-free products almost always contain alternative sweeteners. So this idea of no added sugar, number one, is misleading because of the zero point 0.5 grams sort of regulation. In other words, you need to be less than zero point 0.5 grams. And then the other part is when you see things like reduced sugar, oftentimes they'll combine sugar also with artificial sweeteners. So read not just the nutrition facts, but also read ingredient lists. Sweeteners have to be listed, but sugar alcohols might only appear in ingredients unless the product makes specific claims. And the order matters in the ingredients. They're always listed by weight. So in other words, whatever has the highest amount. So if it's sweeteners, you'll see them near the top. And then watch out for sweetener blends. Nowadays, manufacturers are trying to combine multiple sweeteners to mask aftertaste. And this is oftentimes when you're talking about things like sucralose, for example, they'll combine with acesulfame or stevia with erythritol. And these blends, they make it harder to track your total overall intake. Then the final thing is be very careful with protein bars and powders, flavored waters and sports drinks, yogurts that are marked as light or fit, and of course, salad dressing and condiments, bread and goods that are marked low carb. So oftentimes when people say low carb, they'll put in alternative sweeteners just to enhance the flavor and make it appetizing. What's sort of fascinating and scary all rolled up into one to me is the average person consumes sweeteners from about 5 to 10 different sources daily without even realizing it. And so if that's something that you didn't know about, take a look and see where you can actually make some changes. All right, let's start to bring all of this together in some practical guidelines. For healthy adults focused on longevity, minimize all sweeteners. The mortality and disease associations are concerning enough to really think twice about having them. And if you must use them, please stay below 1 serving per day. Always prioritize whole foods and try to retrain your palate to appreciate less sweetness. For CKD patients, avoid high intake of any sweeteners. And if needed, small amounts of stevia or erythritol appear safest in studies. Once again, stay well under 7 servings per week from all sources. And you want to monitor your kidney function always. The idea here for any disease is not just to take medicines and try to treat the symptoms, but really, can you focus on addressing the root causes? For diabetes, remember, sweeteners can be tools, but they're not solutions. Use them strategically to replace high sugar items, but not as daily staples. This matters because what we're trying to do is, once again, retrain your palate so that a strawberry starts to taste sweet again. And same thing for weight loss. Remember, short-term use to break sugar habits, it can be helpful, but have an exit strategy. Sometimes what happens is people switch to alternative sweeteners and then end up eating more because they think, well, I'm not having sugar. And for kidney stone protection, avoid all sweetened beverages when possible. And if you have to choose something, sugar alcohols appear to be the safest, but there are GI side effects. And then general tips for everyone is try to give yourself sugar-sweetened beverages and alternative sweetener-free days. In other words, give yourself a chance to reset your taste perception. Remember, sometimes what happens is the absence of immediate harm gives us this sense of security and safety, but it doesn't equal long-term safety. Just because you didn't have a reaction in the first few months to an alternative sweetener doesn't mean that it isn't doing harm inside. Caution is still warranted. And don't let sweeteners become a crutch that prevents you from really working on changing your dietary habits and lifestyles. So I hope this video was helpful to you. I hope you're starting to realize with part 1 of this video and this current video that there's so much to know about sweeteners, and just because they're marketed as sugar-free doesn't mean that it's better for your health. And so with that, I want to end this video just like I always do, to remind yourself to be kind to yourself as you navigate these complex health decisions. Look, changing lifelong habits isn't easy, and perfection is not the goal. Progress, though, is. Every small step you take towards better health matters. And please be kind to others. Do something kind for someone else. And thank you so much for supporting me on this journey, for supporting this channel. If you found this helpful, hit that like, subscribe button, share it with someone that might find this helpful, and I'll see everybody next time.